Spondyloarthritis is an musculoskeletal disease. Look at this picture, shows that CT findings, MRI findings, detail going on. Introduction. Spondyloarthritis is a group of inflammatory disease that primarily affect the spine and in some cases the joints of the arm and legs. These diseases can cause significant pain and discomfort and may lead to chronic disability if not properly managed. Definition. Spondyloarthritis refers to a family of long-term chronic diseases of joints. They share common features such as inflammation of the spine and sacroiliac joints and tendency for familial occurrence and a strong association with the HLA-B27 gene. The main types of spondyloarthritis include 1. Ankylosing spondylitis primarily affects the spine and sacroiliac joints, causing pain and stiffness. Second, psoriatic arthritis associated with psoriasis. It affects joints and can also lead to changes in the nails. Three, reactive arthritis triggered by an infection in another part of body. It causes inflammation of joints, eyes and urethra. 4. Enteropathic arthritis associated with inflammatory bowel disease like Crohn's disease and ulcerative colitis. 5. Undifferentiated spondyloarthritis presents symptoms of spondyloarthritis but does not fit into any specific category. Causes. The exact cause of spondyloarthritis is not known, but it is believed to be a combination of genetic and environmental factors. The HLA-B27 gene is strongly associated with the disease, suggesting a genetic predisposition. Risk factors. 1. Genetics. Family history of spondyloarthritis or HLA-B27 gene. Second, age typically begins in late adolescence or early adulthood. 3. Sex. Males are more frequently affected than females. 4. Infections. Certain infection can trigger reactive arthritis. Complications: 1. Chronic pain, persistent pain and stiffness. 2. Reduced mobility. Joint damage can lead to decreased mobility. 3. Eye inflammation. Uveitis can occur, causing redness and pain in the eyes. 4. Cardiovascular issues, increased risk of heart disease. 5. Osteoporosis, increased risk of fracture due to weakened bones. 6. Neurological issues, compression of nerves due to spinal changes, as we had seen in that CT and MRI. Pathophysiology. Spondyloarthritis involves an inflammatory process in which the immune system attacks the body's own tissues, leading to inflammation, primarily in the spine and other joints. This inflammation can lead to new bone formation and joint fusion in severe cases, causing stiffness and loss of flexibility. Signs and symptoms. 1. Back pain, chronic pain, stiffness, especially in the lower back and buttocks. 2. Joint pain, swelling and pain in other joints. 3. Reduced flexibility, decreased range of motion in the spine. 4. Fatigue, persistent tenderness. 5. Enthesitis, inflammation at the site where tendons or ligaments attach to bones. 6. Dactylitis, swelling of fingers and toes. 7. Uveitis, eye inflammation causing redness and pain. Diagnosis. 1. Medical history and physical exam, detailed history and thorough physical exam. 2. Imaging studies, X-ray, MRI, CT scan to detect changes in the joints and spine. 3. Laboratory test, blood test for inflammation. Markers, CRP, ESR and HLA B27, genetic marker. 4. Diagnostic criteria, using specific criteria such as the modified New York criteria for AS. Nursing diagnosis. 1. Chronic pain related to inflammation and joint damage. 2. Impaired physical mobility due to pain and stiffness. 3. Fatigue related to chronic disease process, risk for impaired skin integrity due to immobility. 4. Knowledge deficit regarding disease process and management. Disease management. 1. Patient education, teaching about the disease, treatment options and self-management strategies. 2. Pain management, medications, physical therapy and other modalities to control pain. 3. Exercise, regular exercise to maintain flexibility and strength. 4. Nutrition, balanced diet to support overall health and reduce inflammation. 5. Supportive devices, use of braces or other devices to aid mobility. Treatment medications. 1. NSAIDs to reduce inflammation and pain. Second, DMARDs, disease modifying anti-rheumatic drugs to slow disease progression. Three, biologics, targeted therapies to control inflammation. 4. Corticosteroids for acute flare-ups. 5. Physical therapy, customized exercise programs to maintain joint function and reduce pain. 6. Surgery, in severe cases joint replacement or corrective surgery may be needed. Psychosocial medicine. 1. Psychological support, counseling or therapy to manage chronic pain. And emotional impact. To emotional support, support groups and community resources. 3. Stress management, techniques to manage stress and improve coping skills. Prevention. 1. Early diagnosis and treatment, prompt intervention to slow disease progression. 2. Lifestyle modification, healthy diet, regular exercise and avoiding smoking. 3. Infection control, managing infections promptly to prevent reactive arthritis. Conclusion. Spondyloarthritis is a complex group of inflammatory diseases that requires comprehensive management, early diagnosis, and multidisciplinary approach can help control symptoms, improve quality of life, and prevent complications. With advancements in treatment options, individuals with spondyloarthritis can lead active and fulfilling lives. Thank you. Have a wonderful day.